in my opinion, do not need bureaucratic rules and regulations in terms of how to open the schools safely. I'm Dr. Jane Hughes. I'm an ophthalmologist, ophthalmic surgeon in practice in San Antonio, Texas. I also had the privilege of serving 2 terms as a trustee for Northside Independent School District, which when I left had 80,000 students. I have read the CDC's recommendations for reopening schools, and I'm extremely alarmed by what I have read. I am fully convinced that the CDC guidelines did come from bureaucrats. I didn't see any authorship on it. I cannot imagine that a private sector physician, with the information that we now have at hand, could possibly go along with this. Actually, there's an excellent opinion piece by Scott Atlas, who is a physician out of Stanford, the Hoover Institute there. And in it, he quotes the the JAMA Pediatric Journal with their opinion as well. Open the schools. It is safe. It is not children who are getting the disease, and the ramifications of not opening are great. Obviously, the CDC did not discuss this with him, and his associate, who also wrote the article, it was in The Hill, is a PhD contributor to the Hoover Institute, whose area is educational policy and governance. So what we have from the CDC is twofold: really dangerous recommendations, and also an error that the federal government on the federal level should be dictating to schools how they handle any issue, especially this issue of COVID. Let's talk to our physicians down working in the states and the cities, on the ground, if you will. We have our health departments. We have our practicing physicians. We, in my opinion, do not need bureaucratic rules and regulations in terms of how to open the schools safely.